All right, next we're going to have Dr. Alza Deegan from Medical College of Wisconsin present coil embolization of persistent type 1 endoleaks.
Good afternoon, and thank you for the opportunity to present my work. I'm presenting a case of persistent type 1A endoleak, which was treated by coil embolization. Our patient is a 79-year-old female with multiple comorbidities, which was not a good candidate for open surgical repair or fenestrated repair due to the severe angulated neck and short seal zone. She underwent endovascular repair of infernal abdominal aortic aneurysm and demonstrated type 1 endoleak in completion angiogram. Here you can see this is the initial aortogram, which demonstrates the aneurysm and angulated neck and short seal zone. Could you play the video, please? This is the completion angiogram after deployment of the graft at completion, which again demonstrates type 1 endoleak. And after angioplasty of the seal zone, we were able to add an aortic cuff, which only gave us a few millimeters of additional seal zone, which didn't help in treating the type 1A endoleak. And finally, we used endo anchors to be able to get a seal or a coaptation of the aorta and the endograft. So even though the traditional teaching is to, you are not supposed to leave the operating room with type 1 endoleak, but due to the long procedure time and the radiation, we decided to bring her back, and we brought her back in about a month, and the aortogram demonstrated persistent type 1A endoleak, which was draining into lumbar arteries. Fortunately, we were able to get access to the sac above the graft, and coil embolization was performed by using concerto coils. And the final angiogram demonstrated, intraoperative angiogram aortogram demonstrated the resolution of the type 1A endoleak. And this is a 3D reconstruction of the aorta. And could you play the right video too? And this is 1 month after the procedure, which demonstrates the type 1A endoleak has resolved. So basically, these are the available strategies to treat type 1A endoleak. Usually, in these cases, for embolization, what is more common is to use onyx or glue, but onyx creates a lot of artifact after the procedure, and if it's unsuccessful, it's very difficult to see the endoleak after the treatment. And so overall, I think this was my first experience doing this case, and I haven't seen many cases reported of type 1 endoleak repair with embolization with coils. But I think this is a viable option for treating the type 1 endoleak, and in comparison to onyx injection, coiling of the sac is done in more controlled manner and with less artifact effect if it's done with detachable coils. Thank you.
Thank you. We'll open up for discussion. Do you have longer follow-up now, since it looked like your last follow-up was in 2021?
Well, next one is going to be in 6 months, and then yearly after.
And have you seen still no resumption of the endoleak?
No.
Ross Milner from Chicago again. First of all, thank you for participating in Raghu's presidential address. Your story is powerful, and we appreciate sort of the determination and perseverance. It's impressive. I say that because I'm not going to be nice now with my next comment. I put a lot of endo anchors in. For better or for worse, I'm a very conflicted individual, so I do a lot of work presenting on endo anchors. And we also do a lot of research on endo anchors. This is not the right place to use them, I don't think. This type of neck is not the right neck, and I get concerned when people put presentations out there like this, that the message is misunderstood, and you're doing a challenging case, and I get that, but this is someone who probably should have had a fenestrated or parallel graft or something other approach if they weren't a candidate for open surgery. And I don't think that I'm pleased for you that you have a good result right now. This is not a durable result. So more of a comment than a question, but I think this is where the criticism comes for using this technology in this type of circumstance.
Yes, thank you.
I kind of just want to pile on. I'm sorry. I'm sorry. I think that we expect to repair these in people that have a life expectancy of 2 years or so. And I think it's very hard to look at this aneurysm and assume that there'd be a durability of 2 years. Let's say you get 3 years out of it. I'm not sure we've really helped the patient. So I think that's something that has to really be, discussed.
Thank you.
Thank you.
Thanks.